Ready to rock and roll?
Yeah, ready when you are.
All right, guys. We are back, Thunder Valley Fit Fam. We are downtown this morning at Market Street Media. It is a new media company that has been started. Just started a timer. That's what that noise is. Anyway, we are downtown here. New media company. It was started by Drew Bedard and Leighton Hart. And so if you notice the change of scenery, that's what's going on today. We have got Dr. Timothy Jenkins, who is an orthopedic surgeon at Watauga Orthopaedics. And Doc, if you don't mind, just go ahead and share a little bit about yourself. And yeah.
All right, Brad. Thanks for having me on. My name's Tim Jenkins. I live in Johnson City, and I've lived here for about 11 years. I've been in Johnson City. I grew up nearby. I grew up in the mountains of North Carolina on a small farm. I always really was interested in medicine and wanted to do something in medicine. So I chose ETSU for undergrad. So I came to Johnson City for undergraduate at East Tennessee State University in an honors program. And I stayed in Johnson City for medical school. Finished medical school at Quillen College for 4 years. And there's not an orthopedic surgery residency in the area, so I went to Jackson, Mississippi. It's a really busy, well-known orthopedic surgery residency for 5 years. I did a fellowship in Sydney, Australia for several months, an AO fellowship, which was a great experience to see that. And then when I finished my residency, I came back to Johnson City to practice general orthopedics. I've been married in Johnson City to a fellow Fit Club member, Katie, and we have 3 kids. And
what are their ages, Doc?
I have a daughter who is 9, a son who's 7, and another son who's 2.
Awesome. So were you recruited back here to work by Watauga, or?
I got to know a lot of the docs with Watauga during medical school, and really liked the group, and liked the camaraderie, and the mentality of the group is kind of rare. It's a really good group of men and women.
Yeah, definitely. We know several of the guys from over in your group, and they've all been awesome members. So and I kind of did several different things when I first got back. You kind of in a high stress field such as orthopedic surgery, I wasn't the most effective person to keep up with health and keep up with personal well-being and residency with no free time. And I always wanted to. I always thought it was very important, and I always understood the benefits of maintaining health and exercising. And I've read most of the thousands of research articles that describe how important it is, but just didn't, for many reasons, didn't have the motivation. It's kind of like
didn't have the time.
It's kind of like I tell people sometimes life kind of just gets in the way.
Yeah, it's just so busy.
And you just get tugged so many different directions, especially as busy and as important as your job is.
Exactly. So when I came back, I wanted to explore, find an avenue where I could exercise and stay healthy. So I tried everything. You start out with buying a treadmill or an elliptical, and then you go to maybe try a gym membership. So I tried the wellness center for a little while, and then I tried different things and never really stuck with one. Never really enjoyed long distance activity like running and things like that. I just don't have the body mechanics for that. And I finally had some fellow workers that I worked with that described Fit Club and CrossFit. And
now, who was it that got you over to Thunder Valley?
It was Sean Sutherland.
Okay.
It was one of the PAs that worked with us, and he was one of the ones that started. And I think John Tilley was another PA.
There we go. Yep.
That was going before, and I saw these guys, and I've been reading a lot about CrossFit and saw the games and different things, and it looked like a really good way to make exercise interesting.
Definitely.
So that's when I decided to try the on-ramp.
And not to stop you, but I actually had a question for you a little bit later.
Mm-hmm.
So I want to come back to this just a little bit later, if you don't mind. So I want to tie it back all in, and we'll finish with this maybe at the end. But so members, today we're looking at talking to Dr. Jenkins and getting some of his expertise in the medical field and giving you guys some stuff that I'm kind of looking for a mashup of health and fitness and some things you guys can take away that you can apply to make yourself feel better at the gym and perform better. So, Doc, here's what I was thinking today. I want to keep it at like 2 to 3 minutes per question. So these are like a real quick fire so we can get a lot of things in the next little bit. And so if you're ready to go, let's do it.
Yeah, shoot.
All right, so our most common injuries we see at the gym are typically back, shoulder, or knee injuries. What do you see the most of at the OR?
In my clinical setting, I'm a general orthopedist, so I see everything.
Mm-hmm.
I would say knees are the most common injuries that we see.
And why is that?
It's it's multifactorial. I would say it's because the legs and the knees are walked on the most.
Okay.
You don't walk on your shoulders as much. And it's a complex joint with a finite movement, and people go outside of the normal realms of movement frequently.
Gotcha. Is that more older individuals, or what age group are you talking about that are coming in with knee
I
issues?
see all ages really. It's more common with age.
Okay.
The older the age, the more common the derangement of the joint is. And I also see many young folks, teenagers with knee injuries that's more related to activity level. So it's part of
Gotcha.
It's whether it's a degenerative disease or whether it's a
Activity.
traumatic. Yeah.
Okay, so give me, when we go back to that back, shoulder, and knee injuries that we're talking about we see at the gym, give me 2 things for your back, for your shoulders, and your knees that we can do to relieve those aches and pains that we might have. And that can be anything as far as stretching, exercise, nutrition, whatever. So for the back, what do you got for me?
For back, that's such a broad question, and there's so many things that can contribute to back inflammation and pain. I would say if I had to pick the top 2, just right off the top of my head for back health, I would say maintaining a good weight, and what goes along with that is what you put in your mouth. So if you increase your sugar intake and you increase your glucose load in your body, you're going to have a bad back.
So basically, like any kind of belly fat that a person might have is
Right.
going to pull them forward and affect their posture, which in turn might affect the back.
So I would go so far as to say it's not even it's the quantity of food. It's more of the it's basically the carbohydrate or the sugar load
Okay.
of the food, because that the more sugar you eat, the more it turns into glycosylation end products in your body, and your back, your vertebrae in your back, those little discs into space,
Gotcha.
they have no blood supply. So if you have any vascular problems, or if you have eaten a lot of sugar, then you have a poor vascular flow and hardening of the arteries, and those discs aren't nourished. So,
Okay.
So a lot of that, it would be food intake, avoiding sugar, and back mechanics are very important. Like the back is meant to flex and extend. It's not meant to twist.
Move laterally.
So it's an unnatural motion to twist your back, and
Got you.
it causes a lot of harm in the back.
So diet and proper movement patterns of your back.
Movement patterns and diet are
Even
huge.
like bending over to pick up a kid.
Yeah,
No
yeah.
rounded back.
Picking up your 2-year-old.
Okay.
Every day would be.
All right. So what about for shoulders? What do you got for us?
Shoulders, 2 of the best things to prevent a shoulder injury are activity patterns, what activities you're involved in. So the shoulder problems are usually caused with poor posture related to repetitive activity. So if you do
Give me an example.
heavy overhead presses with poor posture and your shoulders forward, it puts a lot of strain on your rotator cuff.
So push that head through and extend at the top on that
Exactly.
press.
You have to have
Harrison or
good
Thomas.
form with your shoulder movements. And most of the people I see today have forward flex shoulders. Their shoulders come forward. Everybody's on a cell phone
Cell phone, yeah.
now, and they have kind of the text neck.
Yep.
And the shoulders come forward, and the shoulder bones actually comes forward out of the socket some. So that tends
So this needs to be our new cell phone position, is what you're saying.
Exactly.
Okay.
So yeah, if you're going to be on a cell phone, you need to be mindful of how you're sitting and your neck posture and your shoulder posture, and everyone needs to work on pulling the shoulders back.
Okay. And then I know you said a lot of knee pain is derived from walking. So what can we do? Obviously, we've got to walk every day. So what can we do that maybe will help?
If I had to pick two things, I'd say would prevent knee injuries. It would be also maintain, kind of like along with the lower back, the lumbar spine. It would be maintaining a healthy weight. Weight is enormous pressure on a knee joint. So I think the mechanical number is for every pound of weight you gain, that's 4 pounds of pressure.
Yep,
on your
I've heard
knee.
that statistic as well.
So it's multiplied. So maintaining a good weight, and then the knees kind of go along with the back. They're designed. They're a flexion extension joint. So when you go to twist and you go to put it in an awkward position, it tends to cause injury.
Okay.
So, and then one more thing for people that are working out in the gym, deep flexion of the knee puts an enormous amount of stress. So
And just to dub it down, what do you mean when you say deep flexion?
So like baseball catchers are one of the most common people that we see with horrific knee injuries because they're squatted down in a deep squatted position.
Are you one of the doctors that is against squatting below parallel?
I'm against using your knee as a hinge to kind of bounce off.
All right, fair enough.
Because it increases the pressure dramatically.
Okay. So
the pressure on a knee with walking is like 1 times. If you jump as high as you can, it increases it like 6. If you squat down as low as possible and stay squatted, it's 50. The pressure on your bone is 50 times normal with a deep squat.
So one of the movements we'll see at the gym that people have the tendency to get in the position you're talking about the most is that wall ball rep.
Mm-hmm.
They'll kind of like bounce in the bottom of that hole.
Yeah, any bouncing on the knee, you're going to eventually cause problems.
Yeah, so we need to control and kind of stop ourselves on that wall ball rep. Maybe
trying to maintain control.
Okay.
The whole, the entire exercise is important.
Gotcha. All right. Moving on, I got a couple questions for you here. I'm going to give you 3 things I want you to prioritize in level of importance, okay? Hydration, making sure you have adequate sleep or eating quality foods. If you had to rank 1, 2, and 3 most important, what do you got for me?
I would begin with number 1 is sleep. I know our culture today doesn't value sleep like it used to, and the mentality is I'll sleep when I'm dead. But you're going to get there a lot quicker if you don't sleep. Your life's not going to
right.
And so sleep is, and we don't even in modern medicine we don't even understand the full benefit of sleep. But I think the average American needs at least 7 to 8 hours of sleep, and without sleep, I think missing. And I've looked at a lot of the research on sleep deprivation and losing one because I do it a lot. I'm up all night operating sometimes, and losing 1 night of sleep affects your brain and your body function for up to 7 days.
Wow!
And it's really tough to recover from that.
And of those 3 that I mentioned, if I told someone to drink a gallon of water, sleep, or eat healthy, that's definitely the easiest. So you're making it easy for some of the people.
Sleep is. If I had to give you like my top 5 points of sleep, sleep is so. I've read so much about it, and I realize how important it is. And my sleep is not the best either, so I try to improve it a lot. My top 5 points would be for people to take home to try to improve their sleep. Would be to avoid bright light in your eyes past 6 p.m.
Okay, so no cell phone usage, basically.
So a candlelight in front of your eyes for 30 minutes reduces your sleep hormone in half.
Wow.
So if you got your phone in your face, I would recommend people avoid bright light at night. Put your phone on, sleep mode at 6 p.m.
Okay, what are the other 4 you got for me?
And you have to avoid eating. You cannot eat prior to bed. You have to have an empty stomach.
Why is that?
Because your body needs to rest, and if you have food that you're trying to digest, your body can't fully enter a sleep cycle.
There's activity taking place in your body.
There's activity and the food's not
Makes
moving.
sense.
The food's not moving because you're not up. The food's sitting and rotting inside you.
That's the first time I've ever heard that.
So you cannot eat for at least 3 hours before you go to bed.
Okay.
It's super. People don't realize how harmful eating before.
So
they go
start
to bed
eating dinner earlier, people.
Eat dinner early. At least 2 hours before you lay down, minimal.
I'm gonna guess out of those last 3, room temperature.
Room temperature. The American Academy of Pediatrics recommends your children's. This is shocks most mothers. Recommends your children's bedroom to be 69 degrees. My wife's like, this is just makes her crazy to think to set the kid's temperature at 69. She's like, it's too cold. It's too cold.
So,
but like that's the pediatrics that telling to keep the kids' room at 69.
There we go.
And we're keeping our rooms at 72 sometimes, and so our bodies are inflamed and hot. So
just to wrap up those last two bullet points, what do you got?
As far as the
we had room temperature. We had eating earlier,
eating late, room temperature, and avoiding bright light. You have to get enough activity during your day, or you're not going to sleep well. And then if you've been in an office setting at a business meeting and stressed out, you're going to have to move. You're going to have to get some steps in. I recommend 10,000 steps a day.
Okay.
So if you're going to Fit Club or Thunder Valley, you're gonna get there just with that alone.
Without a doubt.
But then the one other thing to help improve your sleep is stress reduction.
Okay.
If you've got something, if you've got anxiety, if you've got 5,000 things on your mind, you're going to have to write them down, put them in a book, a notebook or somewhere next to your bed, and try to let them go.
Yeah, I'm going to dig a little bit deeper into stress here in a little bit, so we'll leave that one alone for a second. Now, to finish out, you had sleep is most important. Hydration, or are you going to go with quality, a diet of quality foods next?
I would say hydration next. Okay. I mean, food's very important, obviously, as we talked about earlier, but I think hydration would be, as far as athletic performance, hydration would be more important than the type of food.
So you're not telling people to go do food prep right now. It's going to be drink water and sleep.
Right.
All right. Making it easy on you guys.
Two, yeah. Now, I could go on and on about food, too. I mean, it's a whole different category, but like if I had to judge those three, that's what I would say.
Okay. So moving on, next question for you. Our average client at the gym is somewhere between 35 and 45 years old. They can only do one of these the rest of their life. Strength training, cardio, and let's call it like biking or running. And then, or they could do body weight movements the rest of their life. So they can go burpees, pull-ups, sit-ups, air squats, push-ups, so on. Which one of those, as far as avoiding pain, would you recommend they opt for?
I would say in that age group, and if it had to be for the rest of their life, I would go body weight movements.
Okay, I like it.
For multiple reasons, I think there are massive benefits to the strength training, but if you had to do one for the rest of your life and you didn't get to do the others, and then one of the most important things I would say is, what are you going to do? What's your capability as you get older, and what do you enjoy? And most people can find something easy and simple, and the body weight movements would be reproducible up into your 60s and 70s.
Okay. So I noticed you got an iWatch on. Are you a big fan of technology and like smart devices and helping better assess your health?
I do look at a lot of the smart devices. I kind of keep up with most of the technology to see what. Mainly look at it for a couple reasons. One is to see what motivates the best. I have a big interest in motivation.
Mm-hmm.
So I think motivation is the elixir that everyone needs, and so I think I look at see of the technology that's available and how much it motivates people to stay active and exercise and picks them up and helps them, give them reminders.
For something they're actually looking at, like if I'm looking at my Apple Watch right now, what specific metrics are you looking at that might help you stay more motivated?
If I had to,
I don't want a priority list. Just some general ones.
Okay, just general metrics. General metrics. If I had to kind of put them in a list of some of my favorite metrics, would be resting heart rate. I think that's important metric to show your general health status. Your temperature is an important one, and a lot of these new devices can measure your temperature on a daily basis. I personally like heart rate variability a lot.
Mm-hmm.
I use that a lot. That one's more difficult to understand, and we can go over some things later if you want to about the best devices that look at heart rate variability. Other metrics, I like monitoring a workout and monitoring my heart rate and my threshold zones, and
More so than like a calorie expenditure.
yeah, I like to know, how hard I'm working. And personally, I kind of push myself too hard sometimes, and I overdo it.
Yeah, I've noticed before, like we've done
older-
some sled pushes, and you'll
Yeah.
check out your heart rate and then bring
The
it back
older I
down.
get, the more prone I am to overtrain.
Yep.
I didn't have that problem, and if I
Which
did,
makes doesn't make a lot of sense, honestly.
yeah, it's I'm not able to turn off the drive, and when you're 40, your body can't recover as well, and your body, if you go too hard at 40, it's totally different than too hard at 25.
Right.
So now I like to keep a heart rate max, and I'll slow myself down if I find my heart rate's up into the 90th percentile. I'm like, I'm going too hard here.
Yep.
I'm not getting. This is not good for my body. I'm not going to get benefit out of this workout. So.
Right, and that's kind of one of the reasons we brought on the My Zone heart rate technology at the gym for that exact reason, because it's broadcasted on the screen, and maybe you continue to push while I'm seeing you hit that red on the screen.
Exactly.
But as a coach, I can come over and kind of pace you down.
I've read some books where they measured high schoolers, and some of these high school coaches, they had a class of kids, and they put a heart rate monitor on them, and they ran them, and so the coach had always like written off this poor little girl, this 16-year-old girl. He thought she was like a dragon.
Mm-hmm.
And like when he monitored her heart rate, this girl's heart rate was faster than everybody in the room. This girl was like killing it. She was like really working hard, and she wasn't getting credit for it because no one knew that for her body, she was doing a lot harder work than the boys that were beating her by like.
Wow.
So like
That's
she was
really
working
cool.
harder, and no one knew that until they monitored her heart rate.
And then on the flip side, Thomas bought a heart rate monitor, and it is true. Like, even though his pain faces look like he's performing at 95%, he actually is just at 55%.
55%.
So he's
good-
been sandbagging us for years.
it's a good indicator of people's true exertion.
There you go. So I got a question for you. I want to touch like some common terms that you might hear when it comes to pain, and one of those being inflammation. What exactly is inflammation?
Inflammation is it's kind of a two-edged sword. We need it. It's how we fight off infections. Like, we would all be dead without inflammation. The problem with inflammation is we have too much of it now. It's nice to have when you need it. Like, say you get a cold, and then you need to fire up inflammation, and it kills everything bad that's inside your body. So your body has to have inflammation to kill bad stuff. So there's viruses everywhere, there's bacteria all over us. So your body needs it, but then sometimes when the cold's gone, your body has trouble turning off the inflammation, and then the wrecking ball is running around in your body and inflaming everything, and autoimmunity is like rampant. Like it's one of the most common things I see in this area. This area has more autoimmunity than any area in the country, I think. And so it's our genetics where we live here in the Appalachian area. So we have a massive amount.
It's important to help with any kind of pain or sickness we might have.
Yeah, say you overtrain in the gym, or say you pull a muscle, say you sprain your biceps, then inflammation is what helps you heal that back.
Right.
But then we have to, the trick is to be able to turn it off.
Okay, and so
after it's done its job.
And that was actually my next question. How do we get rid of it?
So the modern thinking of inflammation is, you want to go to the gym, you want to work out.
You want to get sore.
So why does working out make you better? Why does workout good for you? Because you get inflamed after you work out.
Right.
And so you stress your body, you stress your muscles, you have micro tears, they get swollen, they get sore the next day, and they come back stronger. They grow back bigger, they grow back better.
Right.
So that's why working out is good for people, because it makes your heart better, it makes your muscles better, it makes your bone. Like one of the CrossFitters I just operated on had the hardest bone I've ever seen in a human being. I've never seen bone harder. And I've operated on 20,000 people, and I've never had a harder bone than someone who does CrossFit every day.
Right.
He had some of the most phenomenal bone. And his bone, it's not because he's like any different than anybody else. His bone is like super hard and super strong. He could fall down 4 flights of stairs and never break a bone because his bones are that strong.
Wow.
Because he stresses them in CrossFit every day.
So even
And
though he had an injury and you had to repair him, it's
Yeah, he had an injury, but I would say it's related to this question. I think his injury was probably because inflammation stayed on and wasn't turned off all the way sometimes.
okay.
So exercise, the reason why we exercise is because it damages our body slightly, we get sore, we get hurt, and then our body heals back and makes it stronger. You have to have an interval though, whereby you let yourself heal after you work out. You have to have a space the next day to let your body heal, and you do something lighter, you work a different muscle so you don't work the same muscle every day.
So I would say inflammation kind of typically has about the same timetable, or we feel it about the same as we do muscle soreness, correct?
Yeah, it's related to it is the muscle
Okay,
soreness. That's
so
what it is.
so my question for you is for example, I had a little bit of knee pain from a workout last week, and I've still got that knee pain. So that's obviously not inflammation because I'm not holding on to inflammation from that workout for a week.
Exactly.
Okay.
So the inflammation would be a temporary thing. Inflammation is age and genetic related. So when you're 20, your inflammation is going to be 24 hours maybe max, and your body's really good at shutting it off. When you're 40, your inflammation is going to be 3 to 5 days, and your body is a lot harder, especially if you're diabetic or if you've got some other metabolic problems. Your body has a tough time shutting that down. So there's some new research out now that's looking at how do we shut down inflammation, and when do we shut down inflammation. And some professional sports teams, they have supplements now that's like a fatty acid, like fish oil.
Right.
It's like a specific type of fish oil that they're given to their athletes, and they're letting them stay inflamed for the first day they need it. They can't you don't want to shut it down right when you work out. So you don't want to work out and then take a bunch of fish oil and try to take fatty acids that reduce all the inflammation, because you're not going to get the benefit of the exercise. What you got to do is there's some things called pro-resolution mediators that are out there now that people are experimenting with. We don't know entirely how they work yet, but we're using those to shut down the inflammation after they've done their job. So you work out an intense workout, you stay inflamed the next 24 hours, and then you take the pro-resolution mediators to shut down that inflammation to help kind of reduce all that damage.
Okay. So another question, just to move on. I've got, let's just call it hypothetically, I got a pain in my shoulder. Okay, it's been there, it's been nagging, it's been progressive for, let's call it a month, 6 weeks, 2 months even. Okay, I hear people talk about getting injections. What is an injection, and how do I know if I need an injection or if I have something that's maybe a little bit bigger issue and we need to look at surgery?
An injection is in other words a shot. So you're getting a medicine delivered by a needle and a syringe directly into an area where there's damage or either degeneration or acute inflammation.
And so what does that do?
And so there's about 6 different things that we can inject. So the injection or the shot is it would take a healthcare provider to help you decide what would be best in certain situations. So say you have...
And do you test that based on like an MRI, or is it range of motion testing that you might do with movement patterns?
I would determine, like I do different injections I'll do a different injection. If you came in with the same complaint as an 80-year-old, you would get a completely different injection than I would give the 80-year-old.
Okay, that makes sense.
So it depends on the person, it depends on their condition, it depends on the diagnosis. It's very complex. So let me give you just a couple quick examples. So say someone comes in, say I saw a professional baseball player last week. He's a major league pitcher with locally, and I was examining his elbow. So he had an inflammation of his elbow. So this guy is like in the perfect health. He's the top of the sports world. But he's having pain over an area from just overuse and strain, like increased strain. So my suggestion to the major league player would be something, an healing injection, something to promote healing as fast as possible. So something like that would be PRP,
correct.
So platelet-rich plasma. Stem cells are really overused in this area. They're very dangerous. the American Academy of Orthopedic Surgeons says we've seen some cases of cancer come from stem cells, and we've seen at least 4 infections come from stem cells. So super dangerous thing to have right now without really close oversight, because there's no monitoring of them. PRP's been proven to be effective, so that's something I would do for a high demand athlete if I'm trying to heal him as fast as possible.
What if we got Sally, who's 50 and sedentary, and comes in with the exact same description of the pain?
That's a good one. Yeah, a 50 sedentary that does not need. If I would determine whether she wants immediate symptom relief, whether she's there to see me for immediate pain relief, or whether she wants to fix the problem. And so, if she has motivation and she's wanting to change, then I would send her to therapy, and we would fix the problem by fixing the sedentary behavior. But if she wants immediate relief, then I would, depending on what area it was and what tendon it was, I would either inject steroid or Toradol. So an anti-inflammatory or a steroid anti-inflammatory to stop the inflammation response.
Okay. Next question for you. So obviously we do that once a year workout, Murph. As prescribed, it calls for a 20-pound vest. You look at the guys that are doing Murph in a 20-pound vest, and they just are getting run ragged from carrying that extra 20 pounds for that single workout. What does 10 pounds that I would say 80% of the population carries extra on their body, if not more actually, what negative effects does that have on your body on a day-to-day basis? Just 10 extra pounds.
Yeah, 10 extra pounds. If we break it down into just purely mechanical on the joints first, it would primarily be on the lower extremity weight-bearing joints. It'd be on the knees and hips. Their chances that the pressure would be 4 times higher on the knee joint. 40
more pounds
so
on the knee.
Those folks are going to have meniscus tears at the drop of a hat. They're going to have meniscus tears if they keep that extra weight on longer. The body's just not designed to carry that much extra weight around.
And then, kind of like I spoke about earlier with the back, is if we have that front-loaded belly fat, it's going to affect posture.
It has a cardiometabolic effect, and so that the increased weight is going to be more fat cells. The fat cells, actually, there's some pretty cool research that says that, we look at to see if the weight is causing arthritis or if the fat's causing arthritis. And we could have 2 people that weigh the exact same, and if one has 30% more fat, then the fat cell releases enzymes that dissolves cartilage.
Okay.
So it's not the fact that you have the extra weight, it's the fact that you have the fat cells that are releasing enzymes that damage your knees and damage your hips. So.
And you actually touched base on a question I was going to have for you. So what exactly is arthritis?
Arthritis, osteoarthritis, is it's a systemic disease that is genetic. You tend to get it from your parents if you have the genes to develop it. We don't completely understand why some people get it so bad and some people don't. It's a degenerative disease where the cushion over the ends of the bone, or the cartilage, it's our shock absorber, the cartilage deteriorates and dissolves basically until you get to where you're walking on your bone ends, and so the cartilage dissolves slowly over a period of years. So it happens. Pure osteoarthritis is something that's genetic, and so you tend to get it from your genetics and your family. There can be
Wrestling ain't gonna make this any easier. Let's go.
You can be post-traumatic arthritis too. So you can have perfect genes and have a car wreck, and then damage your knee joint and your cartilage dies. And so you can have post-traumatic or you can have osteoarthritis.
I got to remember not to use a workout timer next time. I've had Roy McKernan yelling at me the whole time. So I think I know the answer to this just based on what you were saying a minute ago, but what can we do right now to avoid arthritis down the road? And I know you said it's genetic in some people. Are there forms of arthritis that are not genetic?
Again, in this area, it's dramatic, the amount of autoimmunity we have. And so autoimmunity means that your body's immune system starts to make a mistake. You actually have a good immune system, but it starts to make a mistake and attack yourself. So the body's immune system is attacking your joint lining. So it doesn't attack your cartilage, it attacks your joint lining. And so the autoimmunity and the rheumatoid type problems that I see those probably as much as I do osteoarthritis in this area. Is there something we can do to prevent osteoarthritis? Obviously, as we talked about the weight, maintaining a good weight,
Yep.
trying to reduce the fat, the amount of fat cells in your body as much as possible. Something like Fit Club or, an exercise program that you're going to stick with. Something that it has to be something that you enjoy if you're going to stick with it to keep the weight off and keep the muscles strong. So by improving muscle strength and doing some strength training, it also reduces your chances of osteoarthritis and rheumatoid arthritis. And then one more thing would be the diet. So
Going back to that sugar
I
intake.
don't think people understand sugar and autoimmunity. Sugar is poison.
Right.
So like if you eat sugar, if you take a cup of sugar right now and you ate sugar water,
Mm-hmm.
if you ate a small Coke, and then that Coke's going to go into your system, you have fungus in your body. Everybody has fungus in your gut, and you have some staph in your gut. Staph and fungus explode on sugar. That's their favorite food. They eat it, and you get a belly and a gut full of fungus.
Mm-hmm.
You're not going to feel good if you
No.
have overgrowth of fungus in your body. And if you have an overgrowth of staph in your body, it causes autoimmunity to get worse. And the best way to feed staph bacteria, staph aureus, is to eat sugar. So the more sugar you eat, the worse you're going to feel. Sugar is
It's
probably
negative returns.
Yeah, sugar's probably, and I do it. It's impossible not to. It's in our culture. It's in our world. It's impossible to avoid. It's at Starbucks. It's in everywhere you go, and it tastes good. Everybody wants to eat it.
Yeah.
So that's why it's so hard to avoid it. But sugar is one of the most potent toxins medically that I know, and sugar is a direct link. I mean, I've seen so much research that talks about the more sugar you eat, the more your joints are going to hurt, the more your back's going to hurt, the more you're going to have arthritis, the more you're going to have poor sleep. I mean, it's dramatic.
So if you're sore, got aches and pains, carrying a couple extra pounds, cut out the sugar, let's see what happens.
Oh, it's
basically.
not see what happens. It's cut out the sugar and sit back and reap the benefits, and you'll feel like $1 million if you can stick with it. 'Cause
There we
it's
go.
like, that's where I'm still trying to look at the magic elixir of motivation to try to find out what's the secret. Getting a mentality like understanding the enemy, treating it like an enemy, and saying I'm stronger than this. I'm stronger than this thing. I know I love sugar. I love that. That cupcake, or I love that donut. I would love that donut, but you got to be stronger. You got to be like, I like to feel good, and I like to look good when I'm 60, and
That's right.
I like to play with my kids, and I don't like to feel bad all the time.
Yep. So I want to talk to you about stress. Stress can obviously play a huge role in this extra weight gain we've talked about, this pain that we've talked about. What toll can stress have on our body?
Yeah. So stress is it's another rampant thing that we have today. So stress is a good thing when in moderation. I've read a lot of the best way to describe it is I've read a lot of books that talks about it, and it says the books say we're meant to run from a tiger once a month.
Right.
And that's great for us. That's good for us if we get away from the tiger.
Right.
So,
But then we also need to run after the animal that we're trying to kill.
and you have to catch a rabbit. You
Right.
have to catch a rabbit and feed your family, and you have to run from a tiger at least once a month. So stress is what when you've got a tiger on your tail. Stress is what constricts your blood vessels. It sends blood to your muscles, and it makes you alert. It makes you think clearly. It makes you figure out how to climb a tree really quick and how to fly. You're super fast when you're stressed out. So the problem with stress is with modern day stress that we have is we're exposed to a tiger every 5 seconds. The
Right, and it doesn't
dopamine-
even have to be a tiger. It can be a social media post.
It's something that your email pops up.
Right.
That's a little stressor every day. So we're mini tiger, mini tiger, mini tiger, mini tiger, mini tiger, and our bodies are just like, it's like, would stop already. I can't, I'm supposed to see a tiger once a month. I'm not supposed to see a tiger 15,000 times a day.
So
So
obviously we don't have a tiger chasing us, but how can we, what can we do to take this on, like to fight this stress?
That's another thing it's really difficult to do in today's world. Unplugging as much as possible would be.
And I assume you mean the phone.
Yeah. You
So
gotta put your phone down.
Go to your Apple settings and set those screen time restrictions.
You gotta turn the restrictions, the notifications off. Personally, I think the best way to do that would be to put your phone in, because we're so like bonded to our phones now. I mean, it's such a part of who we are, and those little devices are constant stressors, and the emails and the Facebook and the Instagram posts are just like continuous.
Yeah, and we're 5 minutes from being yelled at again.
Yeah, and those are good things for social connectiveness and to be to stay in touch with people. There's a lot of good things about them, but it's so hard to turn them off and to get away from them when we need to. So,
and 20 years ago, when the phones were in the car,
oh yeah,
the world still went on.
Yeah.
It existed without Facebook.
It still goes, and actually, I would say that a lot of people now, their mental health is massively suffering because the stress level has been so high for so long, and we can't get away from the phone addiction. It's actually a dopamine addiction.
Right, I've heard before. It's like it has the same effect on the brain as a person that eats sugar or
cocaine.
Cocaine.
It's like a mini hit of cocaine. So when you flip through those Instagram posts or flip through Facebook posts or what people are so hooked on their phones all the time, they would go through withdrawal though. I think people would actually go through withdrawal if they would get nervous if they put their phone away because they're not getting that dopamine spike.
Right, and then I've even heard of people being so addicted to the phone and social media and that dopamine kick that like if they don't get so many likes within a couple minutes, they're removing their post to
they take it down
to avoid the negative connotations that could come from it.
Yeah, so I think that to kind of get away from that, maybe when you get to where you're going to stay that night, if you come home that night, then I would put your phone up and try to stay away from it, try not to touch it. So my wife and I have tried to do that. We've tried to put our phone in a charger when you come home and try not to touch it, try not to get to it, just stay away from it.
That's awesome.
Talk to your family, do something active, take a walk, find ways to kind of occupy your mind without having the stressors of the phone all the time. And then other ways to reduce stress, to help people with the overload that we have now in our world. Yoga is a really good exercise. Obviously, is probably one of the most effective ways of stress reduction. That's one of the main reasons why I come to Thunder Valley is to reduce stress and kind of reset everything.
Yep.
So exercise would be huge. Yoga would be huge. Any sort of activity like yoga where you can kind of relax and breathe, work on your breathing. Biofeedback is really big. There's something called a heart rate variability that you can track, and there's a meditation app called Inner Balance. That's probably one of the most effective biofeedback devices I've ever found. Nothing improves my sleep like using the biofeedback device called Inner Balance. It's a little adapter that plugs into my phone and it hooks to your ear, and you use it, and it tells you your heart rate variability and your breathing status, and it tells you how to breathe deeply. And if I use that before I go to sleep, my sleep quality improves more than anything else. I've looked at everything.
That was one of the things I meant to ask you earlier when we were touching on that technology, the metrics that you're looking at. Do you look at those, and do you pay attention to the sleep quality? Yeah, I do.
And that brings me to kind of that advice. One of my favorite technology devices is called an Oura Ring, Oura, and it's a ring that you wear on your finger, and it's a little expensive, but for the price you get an amazing device.
You've always told me that gives the best metrics of any of them that you.
It gives more metrics than any other device. Way better than an Apple.
So
device.
they have one for females as well.
Yeah,
Okay.
men and women both.
Okay.
So, OURA ring, and it gives you it monitors your sleep. It tells you your deep sleep, your REM sleep, which is pretty accurate.
Now, here's a question for you. I know, like, my watch, it'll bleep and buzz, and that's why I don't wear it to sleep.
Mm-hmm.
Does that give you any kind of notification whenever you get something from your phone?
No notification.
So that would be like a huge one for me, because it's
Mhm.
not going to bother me while I'm sleeping, but yet
Yeah.
I'm still getting those valuable metrics.
Yeah, it's my favorite piece of kind of medical devices, health devices that monitors your metrics, because it monitors your temperature, your sleep, your heart rate variability. It's pretty detailed. It's amazing how complex, and the battery lasts like 5 days, so you don't have
That's
to charge
cool.
it that often.
Hey, I had one more thing I wanted to touch base with you on before we wrap up. So Dr. Jenkins was a CrossFit member with us back in 2013. And being the naturally driven individual he is, he would get in class, and I would always find him, and as a coach, I don't say this much, but he was one of those individuals he would push too hard almost. And you'd find him going head to head with the 20-year-olds that were in there. And I noticed you had the maturity, I guess I would say, and then the self-discovery that group fitness wasn't the best for you. Some people have anxiety when it comes to working out in groups. Yours wasn't anxiety; it was like this.
It was
full throttle effort you're always giving. So I kind of wanted you just to elaborate, and this isn't to plug me or like to give me any sort of compliment. Don't do that. But I want people that maybe find like a similar situation within a group setting. I'd like for you to share with them like what you get out of personal training versus a group setting.
Yeah, the group setting at that time, that's kind of what I was looking for, and the camaraderie is really nice. Like, I miss the camaraderie a lot of the group setting, and the group setting gave me some accountability that I don't have now. And so when you develop friendships and develop some people that you get to know every day.
They're shooting that text saying you're going to the 10 o'clock
hey,
class.
Hey, what you doing Friday night? Hey, you going Monday? And they give each other accountability, and that's that motivation. It's that secret elixir that everybody's looking for, It was something so the group, that's the benefit of the group, I think, and I miss that a lot. I kind of got away from the group thing for multiple reasons. It was more me than anything.
It was Thomas.
Yeah.
He creeped another one out. It wasn't a female this time.
Oh, I love Thomas. No, it wasn't. It was more me personally than it was really anything else at the time. Stuff I was going through, and stress and things. Some crazy stuff that was going on during that time is why I kind of got out of it. But one of the main reasons I did get out of it was because what you said, I was too intense, and I was staying in, like we talked about inflammation earlier, I was staying inflamed too often, and I was going too hard, and I couldn't pace myself as I got older, and as I had a really busy week, and I missed sleep, I stayed up all night operating one night, and then 2 days later I'd go work out, and I was competing again with a 25-year-old.
Right, who's going to recover faster.
And
been sleeping.
And had been sleeping.
Woke up 10 minutes before class started.
Yeah, exactly. And I was kind of overtraining myself, I think. And
to almost the point where you were getting negative returns.
Yeah, I was starting to get negative returns. I was feeling worse because I was going too hard and I wasn't resting enough and I wasn't sleeping. If something happened where I was like stressed out and didn't sleep good the night before, then I wouldn't take the time that I needed. I wouldn't stop for a day and rest. I went and tried to do it again. And now that I have personal training, like it meets a lot of needs for me where I am now. My schedule's hard to work with, and it's hard to like find free time. So I'm really crimped for time. I don't have a lot of free time, so it's nice to have
A little flexibility.
a little flexibility with it, and I am motivated now because if I schedule a time at 9:30, then I know you're going to be there waiting on me. I'm going to be there.
Right.
And then I'm paying for that visit, which motivates me.
Right.
If I was paying a monthly thing, I'd be like, I'm not paying for today.
It's only a $3 an hour class.
I'm like, I'm paying for that visit. I'm going to be there.
Right.
So you got some skin in the game. You're gonna motivate yourself.
Right.
And then one of the best things about personal training for me is I have my favorite things that I know my body likes and I feel good after, and I gave that list to you, and then you make a personal, program just for me. You can't do that in a group setting. It's impossible. You've got too many people you're
Right.
scheduling.
We know what's going to break down your body,
Yeah.
what positions you're not going to be good in.
You know that I don't do, whatever.
Full snatches.
Yeah. You know that I don't do certain things that like something simple that only I have that's quirky, like total bars.
Right.
You know that I don't do that because it hurts my back.
Right.
And so we never do them. I don't have to worry about them.
But you're still getting a good workout because I can
Yeah.
get you on the sliders.
You do the sliders.
And we're doing 30
perfect.
reps. It's going to pump your core just as much.
Exactly. So that's the best thing about personal training is I can have my top 10 favorite exercises, and if I absolutely despise burpees, which I don't really that much, but I can say I never want to do another burpee, and I don't have to.
There we go.
So it's worth a lot.
So don't get a
It's
personal
worth a
trainer
lot.
just to boss them around.
Yeah. But you can say, I don't want to do that ever again.
There you go.
Or if you're a terrible runner, like most people that do CrossFit probably don't prefer running. And I don't either. I'm not a great runner. My body's made to climb a mountain, not to run, a mile.
No problem. We'll just have you do assault bike.
Exactly. So the best part about it is the individualized workouts are pretty huge, and
Cool.
And my body responds best to that. So it's nice.
Awesome. Well, Doc, thanks for coming on. I
Yeah.
think that is a lot of value that members can take and hopefully apply a little bit, uses some motivation at the gym.
Yeah,
So,
absolutely. Glad to be on, and hopefully that helps some people and gives them some pointers.
all right. We'll see you at the gym soon.
All right, thanks.